Diabetes is often called a silent disease for a reason. Many people live for years with elevated blood sugar levels without noticing any obvious symptoms. Yet the damage is silently accumulating. High glucose levels begin to affect blood vessels, nerves, kidneys, and even the eyes long before a formal diagnosis is made. Understanding the early warning signs is crucial because catching the disease in its initial stages allows for interventions that can prevent or delay serious complications such as heart disease, neuropathy, and vision loss. One of the earliest indicators is increased thirst and frequent urination. When blood sugar rises, the kidneys work overtime to filter the excess glucose, drawing more water from the body and leading to dehydration. You might notice that you're drinking more water than usual, or waking up multiple times during the night to urinate. Another subtle sign is unusual fatigue. Elevated glucose impairs the body's ability to use insulin efficiently, meaning cells are starved of energy. Even if you're getting enough sleep and eating properly, you might feel unusually tired, sluggish, or mentally foggy throughout the day. Skin changes can also provide early clues. Patches of darkened skin, often found around the neck or armpits, a condition called acanthosis nigricans, may indicate insulin resistance. Slow-healing cuts, recurrent infections, and frequent yeast infections are further red flags, reflecting how high glucose levels can weaken the immune system and affect circulation. Vision changes such as blurred or fluctuating vision are another subtle symptom. As the lens of the eye swells with excess glucose, your focus may be temporarily affected, giving early hints that your blood sugar levels are not well controlled. Mood and cognitive changes are sometimes overlooked. Chronic high blood sugar can impact neurotransmitter function, leading to irritability, anxiety, or even depression. Some people notice difficulty concentrating or experiencing brain fog. This connection between metabolic health and mental clarity highlights why diabetes is more than just a physical condition. It influences every aspect of daily life, from mood to cognitive performance. Recognizing these subtle symptoms and understanding their root cause is the first step toward proactive management. Preventing diabetes or halting its progression requires a combination of lifestyle strategies grounded in science. Nutrition plays a central role. Focusing on a diet rich in fiber, lean proteins, and healthy fats while minimizing refined carbohydrates and added sugars helps maintain stable blood sugar levels. Incorporating whole grains, vegetables, fruits, legumes, nuts, and seeds supports both energy regulation and gut health. Portion control and mindful eating also prevent blood sugar spikes, teaching the body to respond more efficiently to insulin. Regular meals and avoiding prolonged fasting can further stabilize glucose levels. Physical activity is equally essential. Exercise improves insulin sensitivity, allowing the body to use glucose more efficiently. This doesn't necessarily mean extreme workouts. Consistent movement such as walking, cycling, swimming, or strength training for 30-60 minutes most days of the week can make a dramatic difference. Combining aerobic exercises with resistance training helps preserve muscle mass, which acts as a glucose reservoir, further enhancing metabolic control. The key is consistency, not intensity, to create a sustainable routine that supports long-term health. Weight management is another cornerstone of prevention. Excess body fat, particularly around the abdomen, increases insulin resistance, making it more difficult for the body to regulate blood sugar. Even modest weight loss of 5–10% can significantly improve glucose tolerance and reduce the risk of developing type 2 diabetes. Regular monitoring of weight, waist circumference, and body composition provides feedback and motivation, reinforcing healthy habits over time. Sleep and stress management also influence blood sugar. Chronic stress elevates cortisol, which can increase appetite and insulin resistance, while insufficient sleep disrupts hormonal balance, making blood sugar control more challenging. Regular medical checkups are vital, even for those who feel healthy. Fasting glucose tests, HbA1c measurements, and routine lipid panels allow for early detection and timely intervention. Awareness of family history and personal risk factors is equally important. Individuals with a parent or sibling with diabetes, or those with metabolic syndrome or hypertension, should be particularly vigilant. Early detection enables not only medical management, but also lifestyle adjustments that can prevent progression and protect long-term health. Finally, education and mindful living create resilience against diabetes. Understanding the interplay between diet, exercise, stress, and sleep empowers individuals to make informed choices. Small, consistent changes, such as swapping sugary drinks for water, taking short movement breaks during work, prioritizing sleep, and practicing relaxation techniques, accumulate over time, significantly reducing risk. By paying attention to subtle bodily signals and committing to proactive prevention, it's possible to live a full, vibrant life while minimizing the impact of this silent disease. Recognizing early warning signs and taking deliberate steps is not just about avoiding diabetes. It's about reclaiming energy, vitality, and control over one's health. Once you recognize the subtle signs of elevated blood sugar, prevention becomes a matter of consistent, science-backed habits. Early interventions don't require radical life changes. Small, deliberate adjustments can dramatically reduce the risk of progression from prediabetes to type 2 diabetes. One key strategy is building a structured daily routine around nutrition, exercise, and stress management. Start by incorporating balanced meals that combine complex carbohydrates, lean protein, and healthy fats. Avoid processed foods, sugary beverages, and high glycemic snacks, which can cause blood sugar spikes and strain insulin regulation. Eating smaller, frequent meals helps maintain steady glucose levels and prevents energy crashes that often lead to unhealthy snacking. Physical activity amplifies the benefits of nutritional adjustments. Engaging in daily movement enhances insulin sensitivity, allowing the body to better utilize glucose. Even moderate exercise such as brisk walking for 30-45 minutes a day, climbing stairs, or short high-intensity interval sessions can improve metabolic health. Combining aerobic activities with resistance training builds muscle, which serves as a glucose reservoir and further stabilizes blood sugar levels. Consistency is more important than intensity. It's the habitual incorporation of movement that yields lasting results. Stress and sleep also play crucial roles in managing prediabetes. Chronic stress elevates cortisol, a hormone that can increase blood sugar and impair insulin sensitivity. Techniques such as mindfulness meditation, yoga, deep breathing exercises, or journaling can help regulate stress levels. Adequate sleep, generally 7 to 9 hours per night, allows the body to repair, balance hormones, and optimize glucose metabolism. Irregular or insufficient sleep disrupts circadian rhythms, making blood sugar control more difficult and increasing the risk of progression to diabetes. Regular monitoring provides valuable feedback and reinforces healthy behaviors. Simple tools like home glucose meters, fitness trackers, or smartphone apps allow individuals to see how lifestyle choices impact blood sugar in real time. Coupled with periodic lab tests such as HbA1c and fasting glucose, these data points guide informed decisions and highlight areas for improvement. Awareness creates accountability, encouraging proactive adjustments rather than reactive treatment after complications arise. Dietary focus should include fiber-rich vegetables, legumes, and whole grains, which slow glucose absorption and improve satiety. Healthy fats from olive oil, nuts, seeds, and fatty fish reduce inflammation and support cardiovascular health, which is especially important since diabetes increases heart disease risk. Lean proteins like eggs, poultry, and tofu stabilize energy and preserve muscle mass. Hydration is equally vital. Water consumption helps the kidneys flush excess glucose and supports overall metabolism. Community and support systems enhance adherence to preventive strategies. Sharing goals with friends or family, participating in group exercise sessions, or consulting with nutrition and wellness professionals provides encouragement and accountability. Social engagement reduces stress and makes healthy habits more sustainable. Education about diabetes, its risk factors, and lifestyle management fosters confidence and empowers individuals to take charge of their health journey. Ultimately, the prevention of diabetes centers on attentiveness, consistency, and science-backed lifestyle choices. Recognizing early warning signs frequent urination, unexplained fatigue, vision changes, skin discoloration, and slow healing wounds prompts timely action. By addressing these markers with nutrition, movement, stress management, sleep optimization, and regular medical oversight, individuals can significantly reduce risk, preserve vitality, and maintain long-term health. Diabetes does not have to be inevitable. Understanding the science and acting proactively equips you to live fully and thrive, transforming subtle early warnings into a roadmap for lasting wellness.